that will hopefully empower you to take charge of your own health and to allow you to be as healthy as possible. So, again, thank you for joining. I'm not sure who all is on, but can't see that right now, but I will get to that here momentarily. So, good morning, Charlier. So, I want to just let you know that usually there is a health topic of the month. There is a health calendar globally that people kind of use to be able to share education. So one of the education topics for the month of May, it is National High Blood Pressure Education Month. So I wanted to share a little bit with you about high blood pressure. So I am going to share my screen here and just give me one moment. I'm going to share my screen. I'm going to pop this over here as we begin to learn about high blood pressure and some new things that you should be aware of. And we're just going to get started. Let me do this one thing. Join me now. Okay. So let me, there we go with that. Okay, so let me pull this back up because what I'm going to do is share my screen and I'm going to actually share a PowerPoint with you. So here we go with the screen share. It should be coming up momentarily. Here we go right here. And we're going to go right here. And let's give it a moment to get itself situated. Perfect, perfect. I see the screen. I hope you are seeing the screen. Let me check on my other device to see the screen. So, National High Blood Pressure Education Month. And it's just going to be a short little topic, but I found it beneficial. So, what is blood pressure? Well, basically, let me share this with you. This is according to the CDC and the National Heart and Lung Institute, that this is considered the National Health Education Month for high blood pressure. So I want you to have an understanding because that is one of my favorite things to do. And one of my favorite passages of scripture is with all that getting, get an understanding. It is very helpful to get knowledge, but the part in us understanding what we acquire is huge. So it says, with all thy getting, get an understanding. Wisdom is the principal thing. Yes, wisdom is the principal thing because wisdom teaches us how to act upon, how to actually perform the knowledge that we acquire and the knowledge that we learn. So I just want you to get an understanding. So to make it simple, what is blood pressure? You maybe not even have ever thought about that. But what is blood pressure? Not everyone knows what blood pressure is. So when you look at blood pressure is actually the pressure of blood pushing against the walls of your arteries. Your arteries, you have arteries and veins within your body, and the arteries carry blood away from the heart to other parts of the body. So your blood pressure, as the blood is pushing against the walls of your artery, it gives you a rise and fall of your blood pressure throughout the day, and that is normal. Your blood pressure requires your heart because it is the pump, and so um, when as that heart is pumping, it is causing that pressure upon the arteries and that rise and fall in the blood pressure throughout the day. So, but what do those numbers mean? The first number, which is the top number, is called the systolic blood pressure. And what that measures is the pressure in your arteries when your heart beats. And then the second number is called the diastolic blood pressure. It measures the pressure in your arteries when your heart rests between the beats. Now, if you're like me, I remember when I was younger, when we were learning this in school, I remember lub dub is what we remember to remember the systolic and the diastolic. So the systolic is the lub, that heart, that are blood pressure um, going against the arteries, and then the dub is kind of the chill out, the quick rest. It's that rest. So it's the love dub, and it has a rhythm to it. Now, many people, most people have what is considered to be a normal rhythm of that lub and that dub, but there are some people who have an abnormal rhythm to that lub and that dub, where they may actually express a fast heart rate or a slow heart rate. Some people may exhibit a sporadic heart rate where it goes fast for a little bit, it slows down, goes fast again. So there's something that you may have heard of before, atrial fibrillation, where that is the top part of the heart is actually like it's fibrillating. So it goes faster than the bottom part of the heart. There is also ventricular fibrillation, which is what you don't want, because that bottom part of your heart is actually just going like jello. And when that happens, your heart can actually stop if it hasn't already stopped. I remember when I still did patient care in nursing earlier on in my career, I had a patient who would actually be walking around and he would actually be fibrillating. And that is not usual, because usually when someone's ventricle, the bottom part of their heart, is fibrillating, they are down. And we are in the process of actually supplying some electrical activity with the what do you call it? The I can't even think of it, with the paddles, so that it can get their heart back into a normal rhythm. So you can have atrial fibrillation. There is something called supraventricular tachycardia. There is torsades, where, and I know this is a little bit technical, where I remember that because it's called the twisting of the points. You have to actually see that EKG rhythm, where it's like the points will be here at the top and then the points will be down at the bottom. And usually if a person is exhibiting that type of heart rhythm, it is usually because their magnesium level is low. So it is very important that you are able to have good magnesium levels in your body. I know that gets a long way of what do the numbers mean, but basically the first number, the top number of your blood pressure is the systolic, and it measures the pressure in your arteries when your heart beats. And the second number is the diastolic blood pressure, that measures the pressure in your arteries when your heart rests between the beats. So what I wanted to really share with you today, so like when you go to the doctor's office and they'll say, or if you go to the drugstore and use one of those self blood pressure checks, your blood pressure, the top number, for example, if it's 118 over 70, then that's your blood pressure. What I wanted you to be able to be aware of, if you were not already aware of it, is they have changed the standards for a normal blood pressure. So now, whereas the normal blood pressure used to be anywhere from 120 over 70 to 120 over 80, and that was considered normal, now the normal is considered less than 120 and less than 80. So check this out. If you have a blood pressure that is 120 over 80, and if it goes 121 over 81, then that's considered an elevated blood pressure. So if you look at this chart that I have on the screen, it is actually demonstrating that the elevated blood pressure is now 120 to 129 and less than 80 on the bottom. So that is huge, because there are a lot of people who may be walking around and unaware that the blood pressure is high. Or elevated, I'll say. So you have the normal less than 120 on the top and less than 80 on the bottom. And then when it gets to be higher than 120, but still less than 80 on the bottom, then that is considered elevated. However, now, because there are stages of high blood pressure, stage one of high blood pressure is when your blood pressure is 130 to 139 on the top, or it has or, it doesn't say and, it says or, so it can be one or the other, 130 to 139 on the top, or your bottom number 80 to 89. So check that out, listen real close. If your it is considered high blood pressure stage one if your top number is 130 to 139, and this is consistently, we're not talking about white coat syndrome, where what I mean by white coat syndrome is when you go to the doctor's office and you kind of just get your blood pressure goes up just because of the thought of being there or just being there, or sometimes the wait is long, it just kind of agitates you, or just being or having a visit with the doctor, whatever. That's white coat syndrome. I'm not talking about white coat syndrome. I'm talking about your everyday usual blood pressure when you're doing your normal activities. If that top number is 130 to 139 consistently, or your bottom number is 80 to 89 consistently, that is considered stage 1 high blood pressure. So that being said, there is a stage 2, as you see here on the chart. And I'm not making this up. This is from the American Heart Association, along with, and you can also pull this up on the CDC guidelines, and you can also go to that National Heart and Lung Institute website as well. This is what the new standards are. Stage 2 high blood pressure is when your top number is 140 or higher, or your bottom number is 90 or higher. So again, it's either or. And if there is a consistency with either or, then that is considered stage 2. Now, when you get to be higher than 180 on the top, or higher than 120 on the bottom, that's a crisis. And I encourage you to immediately consult medical attention to get that down, because you are pressing towards the mark of having a heart attack or a stroke. So I encourage you to make sure that you are attuned to that. And some people may not even know that their blood pressure is that high, or because it may that they have gotten accustomed to how their body quote unquote feels, that it's the norm to them. Sometimes when people are expressing high blood pressure, their eyes may be red, they may be a little dizzy, they may have a dull, slight headache, just may feel out of balance. But I encourage you to give attention to your body's cues, and I encourage you to keep an eye on your blood pressure based on these new standards. So let's look at this. Hypertension or high blood pressure, just a little bit more. High blood pressure is also called hypertension. That is the blood pressure that is higher than normal. And we now know, according to the new standards, high blood pressure is greater than 120 on the top and greater than 80 on the bottom. So keep that in mind. Your blood pressure, as I stated, changes throughout the day based on your activity. So if you're involved in a strenuous activity, yeah, it will go up. It may go up. However, once that activity, if you're doing some strenuous exercise, when it goes up, it should come down when you're back at your baseline of activity. But if it's just up when you're just doing your normal activity, that's a problem. So having blood pressure measured consistently above the normal can result in a diagnosis of high blood pressure. Depending on what those numbers are, it will be identified as a designated stage 1, stage 2, or stage 3. So, all that said, what can we do to prevent high blood pressure? Basically, eat a healthy diet. We've talked a lot on here about eating healthy foods. So, of course, just to make it a basic overview of a healthy diet, including lots of green leafy vegetables. My goodness, including vegetables, period. Because in my experience and in my observation, some people's diet has no vegetables. It is a lot of protein, whether that be vegan protein or animal protein. So it's not even the name of the diet, it's what you include in the diet. I encourage you, what I like to do is to consume a plant-based diet. So that means I choose to eat mostly plants. And if I do eat any animal protein, it is clean, it is grass fed, it is, I know where it comes from, and I know the process that it has gone through. So eat a healthy diet, and we'll just leave that one there. The other thing that you can do, number 2, is to keep yourself at a healthy weight. And I do know, just from some of the conversations that we have, that weight is a concern for many. You maybe you may have lost some weight, but now you're at a standstill. And so now you're trying to determine why you're at that standstill and what you can do. do. So once you've lost some weight that you desired to lose or you needed to lose, whatever the case, maintain that weight. However, if you're stuck and you desire to do more, then that's when we need to investigate to see why you're at that standstill. And bottom line, just again, basic and simple, is that we have to see what imbalances are being expressed in your body that has you at that roadblock. That's what I like to say. Number three is be physically active. It doesn't have to be anything strenuous. You can take a nice walk, just get moving. A nice walk, ride your bike, go swimming. If you want to be a little more active, do some burst training, do some yoga, do some Tai Chi, some Qigong. Get some movement in, whatever the physical activity is that works for you and fits in your day. I encourage you to do that. And then the fourth thing that I encourage you to do, if you don't smoke, don't start. If you smoke, I encourage you to take measures to at least decrease the amount that you smoke, and with the goal in mind and focus to not smoke, because as you smoke, that actually constricts the vessels and it promotes the increase in the blood pressure. Limiting how much alcohol you drink if you drink alcohol. So limit that amount. Alcohol, because it is a sugar, it is going to impact your blood pressure, but it also impacts your blood sugar, which in turn impacts your blood pressure, because when there is too much sugar circulating in the blood, it can lead to a thickness of the blood that is not the norm thickness of the blood, and it can also lead to decreased circulation, which requires more pump pressure from the heart to move the blood. And so it can also lead to a buildup of plaque and residue within your arteries and in your veins. So limiting that alcohol. If you think about syrup, if you have a glass and you have water in it and you put syrup in it, you just keep putting syrup in it, what's going to happen? The water is going to get thicker. It is not going to flow as fluidly as just a regular glass of water will. That's what can happen or does happen with your blood flow as you consume alcohol. And so just want you to keep that in mind. Also, the sixth thing is to get enough sleep. Get enough sleep. So, we've talked about sleep for several on several occasions, but at least getting sleep enough to at least 8 hours, 7 to 8 hours of sleep, and going through the sleep phases. I believe we've talked about going through the sleep cycles, and that's what really makes the difference. Is going through your sleep cycles, those 5 cycles of sleep, allowing your body to go through its processes of restoration and healing and detoxification. So, preventing high blood pressure, these are some basic, simple things that you can do. So I know that's been a lot of information in a short time, but hey, if you want to learn more, I encourage you to check out my Facebook invite and join me on Saturday, 1 p.m. to 3 p.m. Eastern Standard Time for a free health hour, where you will learn more about blood pressure, blood sugar, and blood chemistry. And you're talking about, what is blood chemistry? Well, blood chemistry is the lab works that you routinely have when you go to the doctor. It's usually like your CBC, your complete blood count with a differential. They may include a chemistry panel, which shows your electrolytes, your sodium, your potassium, those type things, your lipids like your cholesterol, your HDL, your LDL, your triglycerides, and then some. Within that chemistry, those labs, there is a lot of information that can give an indication of why your blood pressure may be high, as to why your blood sugar is imbalanced, as to why your weight is at a standstill, as to why you may be experiencing brain fog. So I encourage you, if you have the time, register, join us, and you will learn a whole lot more than of what we have learned today, what we talked about today. So that being said, I'm going to stop my share, and I'm going to just kind of check and to see if there's, once I figure out this screen, let me get this back over here. And I'm just going to kind of check and see if there's any questions that anyone has. Let me look over here. Okay, let me get back to Facebook, wherever that is. Okay, so right now, because I don't see what I want to see, um, Let me know if you have any questions. Just kind of send me a PM, a private message. If there's other topics, if this has been helpful, to know that the guidelines for blood pressure has actually changed, so that you are actually more attuned and you can give better care to yourself. You can alert others to what you have just learned, and you can just be a better steward of these temples that our Creator has given us to be stewards over. So, again, I want to thank you for joining me today. I want to thank you for your support. And again, if you have questions, let me know, reach out to me, and I will get back with you. Enjoy the rest of your day. Be blessed, be prosperous, be in your purpose, and be successful. Thanks.